one problem is there, sir. The way patient has to take. So this tablet has to be chewed, and few patients does not like it. So swallowing is easy, and chewing the tablet is difficult for patient.
Okay. So what are you seeing in future? We are going to use this more and more, or this will be one more on the card? Like we have multiple phosphate binders. Neither we are very happy with it, nor we are very unhappy with it.
Exactly.
Is it going to add to the armamentarium, or we are going to use this more? See, after this avalamers, etc. has come, a lot of people have switched over from calcium based to the sevelamer.
Exactly.
So similarly, are you going to switch over to the newer molecule, or you will just add on some people where you think they can afford the cost?
Sir, in most of the patient, in most of the patient in which I added is as addition to sevelamer, because sevelamer is quite acceptable to patients. Few side effects, well tolerated, and if patient is not controlled on sevelamer, so I add this molecule to those patients. But once we get our confidence with this molecule, so we can directly start with this molecule.
I think yes.
Sir, the basic is that, sir, there are different two categories of patients. One patient which is rich and they come to corporate hospital, they have normal calcium with hyperphosphatemia. So for those patients, we have very few options. We can give this sevelamer, lanthanum, and this newer sucroferric hydroxide. And those patients which I used to treat during my DM residency, poor patients having low hypocalcemia with hyperphosphatemia. So in that patients, this again calcium acetate or calcium carbonate is still
Yeah, having hypocalcemia and hyperphosphatemia at the same time is very dicey situations, very difficult. Otherwise, plain hyperphosphatemia, yes, we have the other options. And I think this molecule has got a future. Only thing is a little bit the cost. It is little costly now, but as this molecule gains popularity, I think the price will also come down.
Yeah, more we use, it will come down.
Yeah.
Anything else anybody wants to add on? So I think it was a beautiful lecture. We had it and in details, which is nice. And we had actually went through all the phosphate management. And this is a molecule which is extra in our armamentarium, and probably more and more use will be there in future. And once you get the feeling, or once we get the feeling, probably we'll know where it stands.
That's true.
Yes. Yeah.
If there is nothing else to add, we can end here.
Yes, sir.
Yes, sure, sir.
Thank you.
Okay, sir. Good night, sir. Good night, ma'am.
Good night.